Welcome to Highly Therapized, an in depth exploration of mental health topics, unpacking them one layer at a time. I'm your host, Jenny Petersen, and today we have on Dr. Heather Gonzales, and we're going to be discussing motherhood while navigating mental health. So, Heather, do you want to introduce yourself to the audience?
Sure. I'm the mother of two little girls. I have an 8-year-old who's about to turn 9 and a 3.5-year-old.
Mm-hmm.
And I also live with serious mental illness.
Yep.
So I have bipolar 1. I am a postpartum psychosis survivor from my first daughter. I went on to have my second daughter, even though there was incredible fear of the episode happening again. And I am a doctoral level board certified behavior analyst, which means that I do applied behavior analysis with teens and adults, typically autistic teens and adults with significant intellectual disabilities and complex cases. And I also live with generalized anxiety disorder. And my goal in life is to destigmatize mental illness as well as to, in every interaction I have, I try to make the other person feel less alone. And I think that has been so gratifying for me. I live probably 300 out of 365 days a year with significant mental illness that I'm just covering up and pushing through and grinding. And one of the things that keeps me afloat and allows me to continue working, continue pushing through is that technique of just, I'm going to meet this person and I'm going to try to make them feel seen. And if they feel less alone, that it always kind of cycles back and helps me stay on top of things.
Yeah. Yeah. And I so appreciate how much you do talk about your experiences just because I feel like it not only helps me, I think it helps so many people. And we'll obviously get more into that. So, do you mind first just talking about your diagnosis with bipolar disorder and just kind of like what stage of life were you in when you were diagnosed and what kind of was that like?
Sure. Well, kind of a long story. So,
Yeah.
as a young child, I had very significant anxiety, lots of intrusive thoughts. I kind of knew I was different. I knew I shouldn't talk about it because it was weird. And then when I was 17, I started to feel disconnected from
Mm.
reality, kind of if you can imagine that you think life is a simulation,
Yeah.
you don't feel like a real person. And I was just so sad and I was feeling worthless and hopeless. And so my parents first took me to see the pastor at my church. I was very religious at the time. He had no idea what to say. It
Right.
wasn't helpful. So after that, they took me to a psychiatrist who diagnosed me with major depressive disorder, and put me on an antidepressant. And so that was at 17.
Mm-hmm.
Then I went on to go to Trinity University in San Antonio, which was where I got my undergrad. And in my first year, I just kind of cycled between being really, really productive and horribly depressed, suicidally depressed, feeling like a horrible person. My suite mates would hear me sobbing in the shower. And we didn't really understand what was going on because I was still on the antidepressants.
Mm-hmm.
And so that all kind of cycled through my freshman year. And in my sophomore year, my suicidal ideation became very, very strong. And
Okay.
so I talked to my advisor and I was sitting at a table with her in the cafeteria. And I said, I think I might hurt myself.
Mm.
And she said, "What do you mean?" And I said, I feel like I might hurt myself. I'm worried, and I think I need to go home." And so I had to talk to the dean and withdraw. We were able to make it happen so that I took incompletes and a few withdrawals. And when I was home, I completed the ones that were incompletes,
Mm-hmm.
and I had so many credits from high school that I was still able to graduate on time. But I withdrew on my sophomore year for I only had about 3 or 4 weeks left of the semester, but I was just so scared I was going to hurt myself. So then that continued with the depression diagnosis, and I was like a superstar when I was healthy.
Okay.
I was just doing everything, club
Yeah.
president, musicals, and people would ask me like, how are you doing this? Are you sleeping? And be like, yeah, I'm sleeping 8 hours a night. I don't know. I can. And then I would crash and I would be
Mm.
so depressed. And nobody really took the time to think, okay, you're on an antidepressant, but you're cycling between depression and this incredible energy and productivity. But then my senior year, I was feeling really great. I was just what we learned later was hypomania.
Okay.
So I was being really productive. I was so happy. And sadly, I was 22 and 21, and 22 or 21, but this was a silly reason, but I was like, I'm feeling so great. All my friends are starting to drink. We're 21 and I can't because I'm on medication, but I feel great. So my psychiatrist was actually back in Arizona, and it was a very unfortunate situation. I really should have had a psychiatrist in San Antonio, but my psychiatrist was like remote at that time.
Mm.
And so I called her and I said, I think I want to come off my antidepressants. And she said, okay, which in hindsight was completely irresponsible. But what she did was she made a pretty good titration plan, and I
Okay.
followed it. And so that was in about January, and this was 2007. I was 22. And so over the course of the next 4 months, I was titrating off the antidepressant until I was on nothing. And in March, about spring break, I started to be really emotional, really depressed, starting to seriously think about hurting myself again. I remember graduation, I was just sobbing, and everybody thought that it was because I was so sad to be done with
Mm-hmm.
college or so excited. And I was poised to start a fifth year master's program to become an early educator, to become an elementary school teacher. And so I graduated, and then I went home, and we had about a month until we went on to start the graduate program. So I went home to Arizona, and I was really, really struggling emotionally. I was having some delusional thoughts for the first
Mm.
time. And the first one was that when I was in a class about biology and genetics, I had done a presentation about depression, and in it I had stated, I have depression. And my brain was delusional, and it said, you lied about that. You don't
Oh.
have depression. For whatever reason, my brain was telling me, you don't actually have depression
Mm-hmm.
and you've been lying about it. And for some reason, I thought the police were going to come. And so this was the first kind of delusional thinking I was having.
Mm-hmm.
So the psychiatrist met with me. My parents were very concerned. And what she said is that major depressive disorder can sometimes deepen into psychosis.
Mm-hmm.
And so she put me on an antipsychotic, and I kind of stabilized the delusional thinking, but I was still depressed. And
Mm-hmm.
so we basically decided that my mom would fly out with me for the first 2 weeks of the master's program, which was in like July of 2007. And I was okay for 2 weeks. I was really struggling. And what was actually happening is that and this is kind of skipping ahead, but I was having a mixed episode of bipolar 1, which means that you're both manic and depressed at the same time. So what's really dangerous about that is that you can be and impulsive like in mania, but
Mm-hmm.
also deeply depressed at the same
Right.
time.
Right.
And so what happened was that my mom was walking with me every morning. I was going to school. I was trying really hard. And then one day she walked with me in the morning. She dropped me off, and I was sitting in my bedroom, and I just said, I should kill myself. And
Mm.
it was so impulsive. I didn't have a plan. I didn't research. I didn't know how to do it.
Mm-hmm.
So I took a bunch of Tylenol and I took my antipsychotic. And then I went and sat in my car because I was thinking, well, if someone finds me, then they'll resuscitate me. And this was incredibly strange. I had a beautiful
Right.
life. I was poised to do wonderful things. I had just graduated. My family loved me. There was no reason for this to happen. It was just impulsive.
Mm-hmm.
And so I ended up calling my mom, and I hate this memory, but I said, can you come be with me while I die? And she
Oh my
panicked.
gosh.
Yeah. I don't talk about it a lot really because it traumatized my parents. And so
Oh yeah, I'm
it's kind
sure.
of both their story and my story, so
Mhm.
I don't talk about it that much in my advocacy. But she called the ambulance. They came. They were um, I my mom came in. She walked me to the ambulance,
Mhm.
and I ended up having a seizure from all the medication.
Wow.
And so they ended up having to strap my arms down because I was just flailing. And I woke up and I came out of the seizure and I was just panicked because I thought I was paralyzed.
Okay.
So with the medication in my system, it was very, very. I have very patchy memories. But they took me to the hospital. They did the activated charcoal. That was my first day in a psychiatric ward. And over the next, I think I kept me there for 7 days, and I was discharged. And so then I came home for a while. My parents said, "You don't have to do this master's program. You can wait. You can take a year off. You can go to a
Mhm.
different master's program." But I don't like quitting things. And so I said, "No, I'm going to do this." And so I was talking to my therapist. We were working. We got me on the right antipsychotics. And so then I went ahead and did some work from home. And then in October of that year, I rejoined my cohort,
Mhm.
and I finished that out. And at some point during that year, I went to see a local psychiatrist who saw a lot of low income patients on Medicaid. And so he really was swamped. I would sit in the waiting room for 3 hours waiting to see him, and I would see him for 15 minutes. And he said, "You know, I don't think you have depression. I think you have bipolar." And that was the first time. So I was 23 at
Wow.
that point. And so
And a
then,
short meeting, a short consult to,
yeah,
even
and he was the first person to see that.
yeah.
Incredibly, that just over time, over the next few years, I ended up seeing different providers. My insurance would change. I was really seeing a psychiatric nurse practitioner for most of that, and I was being treated with bipolar meds, but not a mood stabilizer. So they were
Mhm.
putting me on an antipsychotic and an antidepressant. And what a lot of people don't know is that if you're bipolar, it's very risky to take an antidepressant because it can cause something called serotonin syndrome, which basically just amps you into mania.
Mhm.
So it's very rare for a psychiatrist to prescribe you an antidepressant. And this psychiatric nurse practitioner did not put me on a mood stabilizer.
Mhm.
So if you have bipolar disorder, which they had diagnosed me as bipolar 2 at the time,
Oh, oh.
and what that just means is that you have hypomania and depression. And hypomania, if you've ever seen the movie Limitless with Bradley Cooper, where he takes the pill and he can just do anything, that's what
Mhm.
hypomania is. You're incredibly productive. You have wonderful ideas. Um, you might have what's called pressured speech, which is just really, really talking really, really fast. You can make some kind of risky decisions, but they're not typically dangerous.
Mhm.
I'm actually at the tail end of a hypomanic episode right now that's lasted about 2 weeks. But to get back to the story, I was seeing a psychiatric nurse practitioner and then had a depressive episode in my PhD program. That was in 2014. And I thought I needed to quit school. And my advisor said, "No, no, no, we'll put you on independent study. You can finish this." And so at that time, I'm still bipolar 2 is the diagnosis.
Right.
And bipolar 2 means that you've never had a classic manic episode. You've
Mhm.
had hypomania and depression. So in 2014, depressive episode, tried to quit school, advisor helped me. And then in 2015, my husband and I I got pregnant. We conceived a baby.
Mhm.
And I was seeing a different psychiatric nurse practitioner. And because I had had all this history with depression, I was just prepared for postpartum depression. So we talked a lot about that. Um, but what she either didn't know or failed to tell me is that women with bipolar disorder have almost a 1 in 2 chance of experiencing postpartum psychosis post
Wow.
birth, which is essentially it's typically within the first 2 to 3 weeks, but
Mhm.
it's a psychotic break where you are having delusions and hallucinations. It's incredibly dangerous. It's the most dangerous perinatal mood and anxiety disorder out there. And if you're at all familiar with Andrea Yates's story, back in the 90s, she had postpartum psychosis and was untreated. and she committed infanticide and caused the death of her 5 children by drowning them. She's in
Yeah.
prison right now. She's been up for parole for years and years, and every time it comes up, she denies it
Right.
because it's just she doesn't want to live out in the world having done that. So she's the most famous person with postpartum
Mhm.
psychosis. There was a more recent case a couple years ago with a woman named Lindsay Clancy, and she also committed infanticide and caused the death of 2 other children, and then jumped off the roof in an attempt to commit suicide. So
Wow.
it's incredibly dangerous
Yeah.
because not either you have hallucinations and delusions that tell you to hurt your baby, or you're so delusional that you could drop your baby or neglect your baby. Um, you are just not safe with your baby.
Mhm.
And so what happens is that when people don't know that this can occur, they just kind of chalk it up to, oh, she just had a baby, things are weird. But to get back to myself, when I had my daughter Shiloh, this was in 2016,
Mhm.
um, I was starting to have a couple, I was having prodromal labor, which is where you are starting to have contractions, but birth isn't progressing. So your cervix isn't dilating.
Okay.
So because of the pain, I didn't sleep for a Friday night and a Saturday night. And we thought that I was ready to go to the hospital. We came 2 times and were sent home. And on the third time, then I was actually ready, gave birth, easy, easy birth, but could not sleep in the hospital. And then we came home, could not sleep. And nobody knew that I wasn't sleeping because babies are exhausting. My husband sleeps hard.
Mhm.
So I would just be buzzing around the house in the middle of the night, and I would wake up my baby to nurse her when she wasn't hungry. And nobody knew I wasn't sleeping. So six
Mm.
days go by.
Wow.
And then finally, I tell my husband, I haven't slept since Friday at all. So this is 6 days of not sleeping. So we call the line, the emergency line of the OB, and in my memory is really spotty, but I
Yeah.
remember saying to her, "I think I have postpartum psychosis." My husband said that didn't happen, and in any case, I told her I haven't slept in 6 days.
Yeah.
So they gave me Ambien, and I had a good night's rest on Ambien, and then the next day we had kind of a normal day, and then in the middle of the night on that seventh day, in the middle of the night, I woke up, or I actually hadn't slept. I took my daughter Shiloh. I started nursing her, even though she wasn't hungry. And I started to have my first delusion and hallucination. And
Mm.
I was imagining that she was draining my life force from me as she
Mm.
was nursing. And so I had this delusion that she was growing and growing and growing, and I was shrinking and shriveling. And then my delusion turned into I'm in a coma and I'm in I'm in my brain, but the room around me is not real. And so I screamed for my husband, and he says he still has PTSD from that scream because
Wow.
he just ran out. And I handed him Shiloh, and then I started jumping up and down, screaming, "I'm not going to die! I'm not going to die! I'm not going to die!" Because I thought I was in a coma and I had to wake myself up or I was going to die. And my husband is very good in a crisis, but of course was terribly freaked out.
Yeah.
So he gets the baby to sleep, and then he immediately starts looking for a psychiatric hospital for me to be in,
Right.
which is incredible. Um, Clearly, my psychotic break was very obvious,
Mhm.
but what will happen sometimes is that family members will be like, "Oh, it's just not the sleep. It's she'll be okay." But my husband was proactive. A lot of partners will say, "I don't want to send my wife who just had a baby to the hospital. I'm
Yeah.
not going to do that to her."
Yeah.
But he was so smart. He was like, "In the morning, we are taking her to a psychiatric hospital."
Right.
And so in my head, I had a delusion that I had given Shiloh 3 Ambien and that she had died. And so in the morning, my husband drove me to the hospital with my father-in-law, and I just kept screaming that I had killed her, that I had killed her, and they're like, "No, no, no,
Mm.
no, she's with grandma, she's with grandma, it's okay." And they ended up admitting me.
Mhm.
And when I have you ever heard of the Ambien walrus?
Mm-mm.
That
No.
concept? So it's something where people who take Ambien can sometimes have, and I have no idea why walrus is part of this, but it's a semi-typical reaction to Ambien where people they can do crazy things. Like people have driven all the way to Las Vegas and not remembered it.
Okay, yeah.
It's I don't know. It's something that is known among some psychiatrists. So I was taken to the hospital. I was admitted. I was screaming and crying, and they were having to restrain me. I was able to they put me in a room by myself because I was so volatile, and I ended up like within 24 hours being completely lucid. And I could remember what
Wow.
happened, and I was talking. And so they said it must have been the Ambien she took.
Mm,
And so they sent me home. And then while I was home, the symptoms reemerged, and my mom had flown out at that point. She was going to wait a little bit, but my husband and she were talking about how, like, you really need to be here. Please help me with the
mhm.
baby. My husband was working full time. I was not there to help. So they took me back to the hospital, and I ended up being there for 29 days and just not sleeping. I would sleep for 20 minutes in a 24-hour period. I was having horrible traumatic hallucinations and delusions. I thought I was in hell. I thought that a towel on the ground was my dead body.
Mm.
I was just completely experiencing intense trauma for 30 days. And what was really upsetting, and what's something that is a problem in psychiatric hospitals, is that psychosis is not well understood, and it's considered dangerous, and it's considered disruptive. And so they basically made me stay in my room, for most of the
Oh
day.
my gosh.
But behavioral health technicians, who are the ones who are kind of my one-on-ones, they don't get paid a lot. They're not trained.
Yep.
They essentially didn't know how to manage what was going on. So I would not be sleeping, but I would be required to be in my bed, in my bedroom, for 8 to 9 hours. And what would happen is the BHT would fall asleep because they're working overnight, and I would wake up and I'd be having hallucinations. And I was on I don't know if I was on an antipsychotic that made me starving, and I would ask for food, and they would say, no, 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 you go to sleep. So I just lay there eight
Mm,
to nine hours having hallucinations. I felt like an animal in a cage,
absolutely. Yeah.
you know.
Yeah.
And then they put me in a I don't know what they call it. It's where it's like a step down from the hospital, where you can leave after 8 hours. But you come in. It's just like it's daily therapy,
Mhm.
partial hospitalization
Yep.
program. And so I ended up kind of being pretty lucid again after that, when they finally graduated me to that. And I ended up, on the 10th day, I wore the dress that I wore to defend my dissertation. And I went in there and very confidently said, I want to be discharged. And they said, okay. And I got to be discharged, went home, was very lucid,
Mhm.
recovered quickly
Mhm.
in terms of being functional. But I had missed 5 weeks with my newborn. And it's like,
Yeah.
with a new baby, the very first 6 weeks, the bonding and the attachment
Mhm.
start, and the baby should be held and cuddled and, in a perfect world, breastfed, but
Right.
not everybody can do that, and I certainly couldn't because of all the medications I was in. So I
Mhm.
came home, and this baby was like a little stranger to me. Like, I had no idea how to be a mom. It was like, all of a sudden you come home and somebody puts a baby in your arms, and you're like, I don't know what to do. And that caused a lot of depression. So I kind of went from postpartum psychosis to postpartum depression.
Yep. Yep.
And that lasted like 18 months.
Wow.
At 18 months, I finally started to bond with Shiloh. And
Mhm.
my mom suggested I write a blog. And so I started writing this blog about my experience with postpartum psychosis. And I ended up just talking about it a little more. And I ended up feeling like the verbal processing, was helping me start to cope. And I ended up starting to write about other things, about postpartum anxiety,
Mhm.
postpartum OCD. I was getting people to come on and be guests. And that was all being done through the blog and shared on Facebook. I hadn't yet gone to LinkedIn and shared any mental health topics yet. But I was getting really good feedback. People were messaging me and saying, I think I actually had postpartum depression and didn't know it. And that
Mhm.
sounds exactly like what I went through. And I was so ashamed. And what'll happen a lot with postpartum depression and any perinatal mood and anxiety disorder. So there's postpartum depression, postpartum onset OCD,
Mm-hmm.
postpartum anxiety. There is postpartum psychosis, and I might be forgetting something, but those are all called perinatal mood and anxiety disorders, or PMADs. And what'll happen, I know you mentioned that you do not have children and that you're trying to learn about
Yeah.
women
Yeah,
and birth
motherhood is
and
such a blind spot.
motherhood.
Having a baby is such a blind spot for me. And
Yeah.
also, like, I'm gonna be honest, like me as a therapist, right? Like, these aren't things that are really covered in our professional programs, or really, unless it comes up during, when you're getting your license and you're being supervised, really
Yeah.
that would be it.
Yeah. And so, what would happen is that people would message me and they said, I think that's what happened to me, but I thought I was just a horrible mom because I would look at this baby and I would feel no
Mm,
connection to her. I felt like
yeah.
I didn't love her. I didn't feel like I was joyful. And so society says when you have a baby, you're supposed to glow. You just like fall in love with this new baby. And in reality, a lot of women, I think the statistic is 1 in 5,
Okay.
1 in 5 women have postpartum depression. So postpartum depression is has the highest incidence, and postpartum psychosis has the lowest incidence. But 1 in 5 women experience postpartum depression. And so they don't feel this glow or immense love
Mm-hmm.
for their baby. Sometimes they feel like, I wish I hadn't had a baby. I feel so sad. I don't like this baby. And no one will say that to anyone else because it's not what's supposed to happen. And so you feel this incredible shame and you're like, I'm a terrible mom. I
Mm-hmm.
shouldn't have become a mom. I'm going to fail this child. And nobody knows that if you just told another mom or talked about it with someone safe, it's common, and then Dr. Brene Brown, who everybody is pretty familiar
Oh
with,
yeah.
in her, yeah, in her early work, she was doing a lot. There's a book called I thought it was just me, but it wasn't, or something like that. And it's all about women
Mm-hmm.
and shame. And so basically in that, she says, shame festers in darkness. And
Mm-hmm.
so telling at least one safe person allows you to start to heal, because that safe person is either going to listen to you and say, I still love you, or in a perfect world, they're going to say, hey, me too. And
Right.
just that one me too is enough to start the healing process. So, what I really enjoyed about advocacy is that I get to talk about these different things that I've experienced. I get to gather people who've experienced things that I haven't. Like, I didn't have postpartum OCD, but other women did.
Mm-hmm.
I didn't have postpartum anxiety because I was manic, and the mania helped me um, just be happy and bubbly and fun. And I didn't have those things. So I learned from other people as I did this blog. And then as I shared it, it became something that other people would give me feedback for.
Yeah.
And it really led to this drive to be an advocate and to say, I'm in a place of privilege. I am a person who I have my own company. There's no risk of me being fired right now. And if somebody has to do it, and I'm going to choose to do it because it makes me feel better. So for selfish reasons, but also if I can help even one person with whatever post or blog feel less alone
Mm-hmm.
and feel seen, then it's totally worth it.
Yeah.
You know what I mean?
Oh yeah, yeah. And I see so often like you posting on LinkedIn, and like just how much you sharing that has just connected you with so many people. And just like you said, like there was somebody in prison who had found your blog somehow and it was helpful. Yeah.
Yeah. So in terms of that story, I got to be part of a panel at Postpartum Support International's annual conference. And Postpartum Support International, I'll remind you at the end when we talk about resources,
Mhm.
but it's the foremost authority on perinatal mood and anxiety disorders. And if anybody is struggling with their mental health after having a baby, that's where they should go.
Okay.
It's www.postpartum.net. It's called PSI. So their conference, we got together. I think there were 5 or 6 of us PPP survivors, and we shared about what is the most. It was supposed to be kind of lighthearted, like what is the most important thing to know about postpartum psychosis, and then we kind of shifted, and we each just said what we believed was the most important thing. And one of the women on the panel who actually was accused of attempted infanticide,
Mhm.
but was cleared
Mhm.
because of her incredible privilege and the lawyers that she had and the people that she had supporting her. Um, she went on to really do a lot of advocacy with women who are accused of committing infanticide, or do commit infanticide, but it's probably because of their mental illness. And here in the United States, we just really don't have a good system for giving clemency to people who commit infanticide while they are having a psychotic break.
Right.
And so, in other countries, especially in the UK, they do have laws that protect women who are having a psychotic break or postpartum psychosis and commit infanticide. And they, in many cases, do not get prison sentences.
Mm.
But here in the United States, we don't have that. And so there was a woman, her name was Aria, and the woman who was speaking about how she had almost committed infanticide and was able to be released and go on to live the rest of her life very with no legal ramifications, have another child. She had been contacted by this woman Aria from prison, and Aria had committed infanticide and was in jail for I don't know how long, but she found my blog about postpartum psychosis while in jail and reached out to PSI. And this woman who I was talking to, who was the one who had almost committed infanticide,
Mhm.
was the one communicating with her. And she wanted to use Aria's story to say, hey, the only difference between me and her is that I was lucky and I had the resources and she didn't. And we're
Yeah.
going up this escalator in the conference hall. And she goes, I'm going to talk about this woman, Aria. And guess what? The reason she reached out is because she read your blog and she thought, I think that's what happened to me.
Yeah.
And I was like, oh my gosh, that's incredible. And so we're actually making some progress now in terms of clemency for women who commit infanticide. There is just recently a woman who here in Arizona
Mhm.
was committed infanticide and had been imprisoned, and I don't know how long she had served, but over 10 years.
Mm.
And so Postpartum Support International's Arizona branch was working to help her gain clemency. And she'd already served her sentence, but she had an additional sentence. And it looks like she has been pardoned by the governor.
Wow.
And so we're making some progress about postpartum psychosis and not being criminalized.
Right.
Obviously, there's you it to put it in the most blunt terms, you killed a baby, but is were you in a mental space where you had intention?
Mhm.
And so is it more like, is it murder or is it something else? And we're starting to kind of have that conversation now about how when a woman is not in control of her mind, she may do something harmful to a baby out of nothing, no intention. She may drop a baby. She may do something similar to what happened with Andrea Yates, who drowned her children.
Mhm.
These horrible, horrible things happened, but was it the mother's fault or was it mental illness? And does
Mhm.
that person deserve to be in prison, or do they deserve to be um, rehabilitated in a psychiatric hospital? And we're having these conversations now, which is really exciting.
Yeah. Yeah. What a difference. And it's unfortunate because postpartum psychosis is not in the DSM-5, right?
It is not, which is really unfortunate. So, if you there the other perinatal mood and anxiety disorders do have codes
Yep.
that a psychiatrist can put in a chart and get someone the medication for, but postpartum psychosis does not, and it's very strange because it is a legitimate mental illness. But if you have a psychotic break shortly after having a baby, you're typically diagnosed with post birth or postnatal onset bipolar disorder because we know there's
Mm.
this genetic factor,
Yeah.
or psychosis of unknown origin. So, what happens a lot to women is that they get labeled as bipolar. And something I didn't mention earlier is that any person any person can become psychotic when they don't sleep for that long.
Mm,
It is
totally.
not,
Totally.
7 days of not sleeping, you can have a psychotic break. So sometimes that will happen to a woman or birthing person where she just won't sleep and she has a psychotic break, experiences postpartum psychosis, but doesn't have bipolar disorder. So we
Right.
know genetically it's like one in two. So that 50% who don't have bipolar disorder often just get labeled as bipolar. And then
Okay.
they end up going the rest of their lives with this in their medical chart as being a person with bipolar disorder. And then their psychiatrist continues to treat them with mood stabilizers and antipsychotics, and they might not need that. And they may say, I don't think I'm bipolar, but no one will reevaluate me. So it's really, really important that the DSM 5, well, I guess it'll have to be the DSM 6, will acknowledge that postpartum psychosis is an actual mental illness. And then when something is in the DSM, then
Mm-hmm.
people teach you about it. Psychiatrists will learn about it. Maybe counselors will have more education
Yep.
because it's actually in the DSM. And I have a really, really exciting opportunity right now. I have a friend named Ben Van Hook who is an autistic self advocate, and he is part of Division 33 of the American
Psycho.
Psychology APA,
Yeah.
Psychological
American Psych.
Association.
Yeah. Yep.
So they are the ones who develop and create the DSM.
Yep.
And he has invited me to become part of the mental health special interest group.
That is so
And what
cool.
I really want to do is, and this is important for all of us who are survivors, and specifically Teresa Toomey is probably the world's foremost expert on postpartum psychosis, and she had her episode years and years and years ago before it was really known about. She wrote a textbook about it, and she is adamant that we need a diagnostic code for this so
Yeah.
that we can prepare women. And I actually, right now, in the next year, might have an opportunity to work on that. And so, all it's just this ripple effect. Talking about your mental
Mm-hmm.
illness openly destigmatizes it.
Absolutely.
And it's given me so many opportunities to speak, to be part of things, to potentially change the landscape of postnatal care and help other women get a diagnosis that will protect them and their baby. And all of it comes from just sharing and
Yeah.
destigmatizing mental illness.
Yeah. Yeah. And I genuinely like I had known that some of this, was happening in women. I didn't really know much about it. I didn't even know it wasn't in the DSM. And that is crazy because
Yeah.
right, like you said, it's doing such a disservice right now without it being in because now people are getting diagnosed with that bipolar. And
Hmm.
right, we know what happens when we have big diagnoses that stay in our medical charts.
Yeah.
It's really hard to also to get them off.
Yeah. Definitely.
Yeah. Yeah. So with all of your experience, it sounds like a lot of people have been connecting with you and really been supportive and said like, "Yes, me too." Was there ever like any time in your journey where you had professionals that were very like maybe judgy or stigmatized you or
Yeah, so I worked at an ABA company right when I moved to Phoenix. So I had the postpartum psychosis episode, and when you have a full manic episode, they change your diagnosis from bipolar 2 to bipolar 1.
Mhm,
So
right.
I had this bipolar 1 episode. But even though I know that episodic mental illness is an ADA covered disability
Mhm,
and that you are entitled to accommodations,
right.
I didn't tell my supervisor. I didn't tell my chief clinical officer or anything
Mhm.
like that. And so I ended up having stress induced insomnia, which led to me going to the hospital. I was like, I'm not sleeping. I need to be in a hospital. So 3 nights of no sleeping. I'm not safe to drive. And then I voluntarily went into a psychiatric facility for about a week and became very, very manic. And I'm going to say pure mania when
Okay.
I say this because I was having delusions and hallucinations. And the day I went into the hospital at like 3 in the morning, I emailed my chief clinical officer and I said, I am self-admitting to a hospital right now because of my mental health,
Mm-hmm.
and I really need to take some FMLA. And would you please monitor my email for me? I'm going in a few hours. Um, and basically, what happened, there was just a lot of mix ups. I went to the hospital. I was fairly lucid, and they said, "Do you want us to write on your discharge summary that you're able to go back to work or
Yeah.
not?" And because I was pretty lucid, I said, "Well, I can't not work. We don't have enough money for me not to work." So
Mm-hmm.
they wrote in the discharge summary that I was competent to go back to work. But when I got home, it just got so much worse, and
Mm.
I was having very, very strange delusions. I thought we were in the purge, like the movie The Purge,
Yeah.
and that people were being murdered. I thought that for the first time, I thought I was divine. I thought I was female,
Mm.
the reincarnation of Jesus,
Mm.
which is
Yep.
actually incredibly common with bipolar disorder.
Mm-hmm.
There's a feeling of divinity. You
Yeah.
feel like you may be God, you may be Jesus, you may be something. Strangely, very, very common with mania. So I was not well enough to go back to work. And basically, when I got out of the hospital, um, I was very, very sick. And I didn't have my FMLA paperwork yet because I was seeing a psychiatrist who was completely overbooked, and he was not
Mm.
able to see me for 20 days for an FMLA appointment
Wow.
because of he needed a 30-minute appointment to do it. And even though he'd been working with me for 2 years, he wouldn't
Mm.
he wouldn't sign my FMLA paperwork.
Hmm.
So I ended up going to like an integrated care model. And then I was I remember this, kind of funny now. Sometimes what happens with mania and when you in hindsight is funny. But I was sitting with him, and I was talking with him about going back to work, and in my mind he looked kind of like Neil Patrick Harris, who Doogie Howser.
Mm-hmm.
And so I was just rambling and rambling and rambling and talking about how he was looking like Doogie Howser, and by the end he didn't look like Doogie Howser anymore. And basically, the whole point of me going to this was to be told that was to get the FMLA paperwork signed so that I didn't lose my job. He said at that point, I you need to come back in like two. Basically, what happened is that most psychiatrists will not sign FMLA paperwork if you're not a current patient. If you're a
Mm-hmm.
new patient,
Right.
they need to know your history a little bit. So essentially, he wouldn't sign it, and then I, there was confusion between my chief clinical officer and my family. She was contacting my husband. They said they needed the FMLA paperwork. I couldn't get the FMLA paperwork the day I was supposed to go get it. He actually quit the same day. It was just
Wow.
series of unfortunate events. Finally got contacted with an actual psychiatrist at this at this integrated care model, and she signed my FMLA paperwork. But it had been already 3 weeks before I could get this
Mm.
FMLA paperwork, and basically we established that I was going to come back in January, and in January I come into work, and my chief clinical officer calls me in and she says, "I'm putting you on probation because in the
Mm.
week before you went to the hospital, you failed to turn in a report and you didn't meet your supervision requirements. So you have 90 days probation. These are the requirements. I need you to send me a detailed log of every single basically minute of your day from 8 a.m. to 5 p.m." Um, Essentially, she was trying to manage me out because I, I, I had become a liability. I had
Yeah.
not disclosed. I had no ADA protections. After a month, she calls me into her office. And even though I had been meeting all my objectives, she says, "I just don't think you're making enough progress."
Mm.
So I hadn't hit 90 days. This is at 30 days. She says, "We're going to either ask you to resign or you can step down from being a clinical supervisor to just being a BCBA. So instead of
Mm.
supervising BCBAs, I could step down. So go
Yeah.
talk to my husband. We can't afford for me not to have a job." So and she had also mentioned that all of a sudden my mileage log was just, I had never logged so much mileage, and that she compared it to my log that she had sent me for every minute of every day, and she's
Hmm.
like, "Well, and I'd never been trained on this, by the way. And most of the time, the logging and the billing, they didn't have an electronic health record system, so it was all by hand, and it was just so much of a hassle that I didn't really. I kind of ate. I ate the hours. I didn't really deal with the mileage.
Mm-hmm.
But then I'd been out of work so long, so I was like, I'm gonna really buckle down. And so I would count the mileage from from a job to say a working lunch,
Mm-hmm.
and then a working lunch back to the job. And she said, well, you chose to drive 5 miles to your working lunch to work by yourself. You can't do that. Like, you could have gone around the corner. And I was like, I'm sorry, I didn't know. And she goes, what I need you to do is to send me an email of the hours that were unjustified, and we'll pull it out of your paycheck. And I said, okay. And I said at the end of that meeting, I will do that, and I will step down and be no longer be a clinical supervisor. The next day, she says, I'm calling you into a meeting as a follow up. And she says, we've decided to terminate you
Mm-hmm.
because it looks a little bit like you are committing billing fraud with your mileage. And we had this, if we were going to bill for clinical emails, we had to put a little bit of clinical work into it, clinical content.
Mm-hmm.
And she said, you mentioned to a family that you had been hospitalized. I think that's a breach of ethics. And there's one other thing. I accidentally put the wrong timestamp on a note
Right.
for an encounter.
Right.
And she said, for these 3 reasons, we're terminating you. And then she left the room, and I had to kind of sit and talk through with another clinical supervisor all my cases. And then
Mm-hmm.
I had to return my laptop and computer,
Mm-hmm.
and I was out of a job.
Wow.
And so I would say that was probably the one really significant professional downfall of my mental illness. And what I would say to anyone who has episodic mental illness is, after you get hired, go to your HR department and request ADA
Right.
accommodation. And you should request, for someone with bipolar, I would specifically say you need to have a plan in place where if you're having precursor behaviors, then they will allow you to either do telehealth supervision, immediately take
Mm-hmm.
FMLA, get out of the field. You won't be paid, but we need to get you away from clients
Mm-hmm.
without the risk of getting fired,
Right.
without the risk of doing something unethical or inappropriate. And so I went to my next job, and I had a wonderful HR person, and we sat down and we made an ADA plan. And basically, it was everything that we had talked about. They were gonna, if I was showing significant signs of precursor behaviors, they were gonna immediately cut off my computer
Right.
access, and they were gonna let me take FMLA, and we had it all in place. And then, long story short, I was pregnant with my second baby, and 20 days before I gave birth, I got called into a meeting and was told that I was terminated. And this probably did not have to do with my mental illness, but it's a long story. There were some there were some things that could have been legally addressed, and we could have sued for wrongful termination, but
Mm.
time passed. But anyway, what happened was that 20 days before I gave birth to my second baby, I lost my maternity leave for
Mm-hmm.
6 weeks, and I lost 6 weeks of ADA accommodation leave.
Right.
And so all of a sudden I had no job, no maternity leave. Um, so I would say one of the things, though, that is good about going through that experience is that the worst has already happened. So
Yeah.
that tells me, why not just talk about it?
Yep.
I already got fired. I already lost my job twice. I am a capable person. I
Oh
can do
yeah.
my
Yeah.
work, and, I can show people that it's important to disclose your mental illness and get ADA accommodations, but also you don't need to be afraid to talk about it with people, because even if you get fired, your life is not over. And
Yeah.
that's why I do feel like I have great privilege. And, Spider-Man says with great privilege comes great responsibility. And so I feel like, as a person who now has gotten through the worst and has a big platform, has a lot of followers on LinkedIn, I feel like it's my responsibility to kind of be someone who can share those things with other
Mm.
people.
Totally.
And I've gotten really good feedback. I hear a lot I feel seen for the first time. I'm so grateful. Keep doing what you're doing. I love it. And so it reinforces my behavior. It helps me process what I'm going through. So when I write down what's going on, it helps me process and helps kind of deal with PTSD or deal with symptoms.
Mm-hmm.
And one other thing, I did get a little bit of professional feedback on LinkedIn. I had a more significant hypomanic episode over the winter, and I was posting a lot, and I was posting a lot of very personal details about what a manic episode looks like.
Mm-hmm.
And a couple of people said, I really don't think you should be posting about this because it may be triggering to other people, or it just may keep you in a headspace. And I had a lot of people come to my defense and say, this is really important for
Yeah.
us, and I want her to keep posting because in my field, when you certify and recertify every 2 years, you have to sign an affidavit that if you have a medical or mental condition that
Mm-hmm.
can affect your ability to practice ethically, then you need to essentially defend yourself. So you have to have a psychiatrist letter stating that you are
Okay.
competent to practice, and that
Okay.
gets submitted. And basically, you self-report an ethical violation, which is just it's a silly system.
Hmm.
But then you provide that documentation, and then they say, okay, we're gonna renew your certification, even though you do have this condition, because you have a plan and you know what to
Right.
do, and you're not going to cause harm to your clients.
Right.
And so people came to my defense and they said, this is really important for people to navigate because she's showing that the ethical thing to do is to self-report to the board, and most people are too afraid to do that because
Yep.
they think they're going to lose their license.
Yep.
And so I say to them, no, here's the letter from my psychiatrist. Here's the screenshot from the board that says you're ready to practice. And
Mm-hmm.
so people came to my defense when this man on LinkedIn was saying, you really shouldn't talk about these things. And they said, one of the things I appreciate so much about Heather is that she discusses how to navigate mental illness in this space ethically. And so I guess those were the two or three really big issues where professionally
There
I
was,
felt
yeah.
harmed by my mental illness.
Yeah. And I would say, like, with that first job that you had discussed, it sounds like they were almost building a case to
Oh, for
terminate you.
sure.
And
100%.
I'm going to be honest, like, unfortunately, whether you're a behavioral analyst or you're a therapist, it's really common in the healthcare field,
Oh,
or
yeah.
a nurse or a doctor. And it's just so unfortunate. So I'm glad that you are saying, like, no, definitely get the supports that you need, report and get the ADA and FMLA. And then the other thing is, like, too, like with our license, like we have to renew every year, and like every year we have to answer those questions of like, do you have, it's the same question.
Yeah,
And
yeah,
so, yeah, like I so appreciate you sharing that story of like you do self-report. It's not this scary thing like we think that it is. We're not going to lose our license. Like it's better to be preventative than it
yeah,
is to, right, like have those actions against us or whatever if something did happen. So,
100%.
and the other thing I
Yeah,
really truly appreciate is like so many times I know on the therapist side of things, like a therapist will get fired from a job, healthcare is healthcare and certain things happen in our businesses. And
yeah,
we think like our career's over. We aren't meant to be a therapist. We aren't
yeah,
meant to be a behavioral analyst. We aren't meant to be helpers. And I love that you just say like it's not the end of the world, and maybe sometimes some beautiful, really beautiful things can happen in those situations, and life is leading us into a really good direction. So,
absolutely.
yeah.
100% agree.
Yeah. Yeah, I'm definitely on the side of like, if people are going to say, "Hey, that's not professional." I truly believe professionalism is, made up. In a way, and like those are not my people. If they're going to judge you, if they're going to say, "Nope, be quiet," like abuse and lies and all those things thrive in silence, just like you said.
Absolutely.
Like when we talk
Absolutely.
about it, we relate and we get through as a collective. So,
Mhm.
yeah. So it sounds like you have like a real team on how you like get through everything, like medication management and probably family supports. Could you talk a
Mhm.
little bit more about like if you feel comfortable sharing?
Yeah, absolutely. So, it's kind of hard to say you can't really put them in a hierarchical order.
No,
That's not
no,
the
but
thing.
you
But
definitely have the things.
I have a husband who knows my symptoms very well and is patient with me. I can be very aggressive
Okay.
verbally and not nice
Yeah.
when I am manic, and I can say some horrible things that I don't really mean.
Mm-hmm.
And he has stayed with me through all of that and understands and asks questions. And he, of course, was the one who put me in the hospital. And although
Yeah.
he felt a lot of guilt about that, it was the right thing to do. So having a partner that is proactive, who is willing to be honest with you and say, like, hey, I'm seeing some symptoms. That's really important. And it has taken, this is probably my first hypomanic episode where I actually took the I don't, it's not even criticism, but um
Feedback.
the feedback, and I was like, yeah, I think you're right. And I mean,
Mm.
I've had a bipolar episode for, I mean, diagnosis for 17 years now, and it's finally my husband can tell me he thinks I'm manic without me getting upset.
Right.
So having a partner, if you have a partner that is supportive, is super important.
Mm-hmm.
Having a long-term relationship with a psychiatrist that you build trust with,
Totally.
keeping every single appointment, following the medication plan, is really, really important. And what happened this time, which was like divine intervention almost, is that I thought, I really, really think I should have an emergency plan, and I think I should have an emergency stash of the
Mm.
medication
Mm.
that got me out of the last manic episode, because basically the last 12 months, I would say 11 of the last 12 months have been episodic.
Mm.
Depression, moderate depression, suicidal depression, hypomania, or mania. It's been a really, really horrible 12 months. And I had this kind of easy 3 weeks. And I was thinking, we figured out what worked with that long manic episode over the winter. Why don't I just talk to my doctor and say, like, let's have an emergency plan. Let's start it the moment I have a symptom. And so she said, I love that. She filled the prescriptions, they were in my medicine cabinet.
Yeah.
So the very first night that I couldn't sleep, so I take medication to sleep. I take a medicine called trazodone.
Mm-hmm.
It's an antidepressant that's very sedating, um, and it allows me to sleep. I really can't sleep without medication. There's some PTSD related to the postpartum psychosis episode, and with the manic energy, I need medication to sleep. But if I don't sleep with the medication, that's a problem, and that's a sign that I'm probably becoming manic or hypomanic. So the night that I only slept 4 hours while on my medication, I started the protocol. And our protocol, just I'm going to share some PHI here, but the protocol is that I take Seroquel, which is a sedating antipsychotic, 4 times a day,
Oh
and
wow.
I take Valium 4 times a day,
Mm-hmm.
small doses,
Mm-hmm.
and then at night I take a large dose of the Seroquel, because keeping me sleeping is what's going to stop me from going hypomanic to manic
Okay.
to psychotic.
Okay.
Basically 3 weeks before this episode started, I had the medicine in my medicine cabinet already. And so this time, this more brief hypomanic episode was stress induced. So I was incredibly stressed, and I was just feeling anxious all the time. And I actually went to Mental Health Day at the Capitol on April 14th, which
Yeah.
was, yeah,
Yeah.
for Arizona. Or is it Mental Health Day nationwide, or
I don't remember. I think it was. I don't know. Anyways, but I
I was
saw
in
that you were an advocate, and I thought that was so cool.
so I got to be recorded for a video.
Cool.
So there was a combination. The night before, I slept 4 hours, so
Mm-hmm.
I started my protocol, and then I had this incredible day where I was just on and feeling excited and really hyped up. And then we knew it really was hypomania. So my
Okay.
husband was like, I had already started the protocol. He says, you have to go reach out to your psychiatrist. My psychiatrist will let me email her, and she will email back within 24 hours. So
Cool.
that's very, very rare, but it's very, very helpful. I've been working with her for 6 years. She said
Yeah.
I'm one of the 3 patients in her long career that is very self aware. So she said, okay, yeah, let's start. But over, that was April 14th. What is it, May 1st today? So I have been having some lingering symptoms. One of
Mm-hmm.
my really bad symptoms in hypomania is overspending.
Mm.
I have a weird relationship with money since I was a child. It's really complicated, but I normally don't spend money on myself. So if I'm starting to spend money on myself, that's a big sign of the hypomanic episode. as well as how much sleep I'm getting.
Do you feel
So,
like it's like an intrusive thought of like I need to spend money, or do you like
well,
like can you kind of explain that mindset too?
well, it's kind of part of the symptomology of mania is
Mhm.
that you have less inhibitions. And so some people have less sexual inhibitions and will go and have affairs
Totally.
or things
Yep.
like that. That's not part of my profile, but I will spend more money. And I guess what happens is that the part of me that feels selfish or guilty from my childhood about spending money goes away, and I think I deserve to have these things.
Totally.
And spending too much money, risk taking, is very common with mania. It's part of
Yep.
the definition. So um, it isn't even that I'm spending well over. I have a tendency to have episodes in the fall to over from like November to January. That was my first one in 2018, and then I had another one this year. Being a mom and dealing with Christmas, the stress
Mhm.
of that, the fact that I had my first manic episode at that time, there's kind of an anniversary. I spent way too much money on Christmas presents. I mean, there are people. I met a woman in the hospital who had a girlfriend, and she bought a car for her.
Oh
Like,
wow.
there are risk taking financial things that are just outrageous.
Yeah.
But I'm engaging basically in a behavior that's very unlike me. I will spend money
Mhm.
on my family, but never on myself. So I may have. I may be overspending in relative to what I normally do, but I haven't spent thousands of
Right.
dollars, you know.
Right.
So
Right.
intrusively, I guess what it means is that I finally feel like I deserve to have nice things too.
Maybe
Um,
there's a tinge of that grandiosity maybe or yeah.
Absolutely, absolutely. And in a normal, I kind of like I live in a dysthymic state most of the time,
Mhm.
which for your listeners is just um mild depression. Basically, you're like low level depression. So most of the time, if I'm not manic, I'm dysthymic and I'm just masking and trying to hide the fact that I'm really having all these thoughts about being worthless and hopeless and not worth anything. But I'm just grinding through, and I do have a lot of issues most of the time with needing to sleep and being fixated on sleep, having almost a sleep addiction.
Hmm.
Um, but trying to get back to what I was saying, the grandiosity, um, now I'm kind of lost. Can you remind me what you were saying about
Just
the
like what are
money?
your supports? What are your like protective
Oh, okay.
factors? And then like your
Okay.
kind of it's almost like it sounds like everything that you're saying too is like a safety plan. Like you're
It's
coping
a safety
ahead
plan.
for
Yes.
that episode.
Yes. Because once you are in a full-fledged manic episode, it is very, very difficult for you to come down.
Mhm.
I didn't really speak much about my second daughter, Vita, but um, my first daughter was born in 2016, and I had decided I don't want any more kids. I cannot go through that again. And there was this fear that if I became psychotic again, I would never come out of it. And then I would have this daughter who didn't know her mom, and I'd be hospitalized. But my best friends ended up getting pregnant about a year before I had my second daughter. And all of a sudden, I was like, oh, I feel like I could do this if I had a plan. And
Mm.
so, speaking to that situation, we had a very, very aggressive medication plan. So, I mean, I don't know how much your listeners know about different medications, but Seroquel is a very sedating medicine.
Mhm.
We had like 900 milligrams of Seroquel plus three benzodiazepines, and it was very, very aggressive, which kept me from becoming psychotic. But I had a 5 month manic episode.
Mm.
So again, we everything was prevention. I went to a trauma informed OBGYN. My psychiatrist met with me virtually at the hospital. I'm holding the baby on my chest and she's meeting with me. I had to be cleared by a psychiatric nurse practitioner at the hospital to go home.
Mhm.
Everybody knew the signs and symptoms. So proactive is really important, but even when you're proactive, sometimes it doesn't the severity of the episode is so high. We mentioned before we started recording about the sensitivity post birth to mental health problems. And
Mhm.
so, for a woman, a birthing person with bipolar disorder, um, birth and menopause are probably some of the biggest triggers for psychosis.
Mm.
because of the hormone dump
Right.
and the lack of sleep in birth.
Right.
And so, um, what I would, if anyone listening has bipolar disorder and is planning on becoming pregnant, I would say, first of all, you can take medication and breastfeed. You can take medication and be pregnant. It's just the right medications.
Mm.
And you need to go to you need to go to talk to an OBGYN and a psychiatrist who can communicate together. And what happens a lot with women and breastfeeding in the postpartum period is that even if they're having very significant mood disorder issues, they will not take medication because they
Right.
believe that it will harm the baby and through nursing, or that they will have to switch to formula, and it's very, very important to them that they want to breastfeed. And what I want anyone listening to know is that if your mental health is suffering, there's nothing wrong with switching to formula.
Mm.
Some women, I was talking to a psychiatric nurse practitioner at a dinner, and we were talking, she specializes in the postpartum period, and she said, if women just stopped breastfeeding when they're having these symptoms and went to formula, all of the problems would go away immediately. They would not need to be treated with
Right.
medication.
Right.
But there are many, many, many medications that pass through breast milk in such small amounts that you can treat yourself or be treated by a doctor and still continue nursing.
Mm-hmm.
There used to be this, the NIH had this reference or this resource called LaxMed, and it would have these studies that would say what percentage of the medication passes through breast milk, what is the risk to the baby. And you probably don't know this not having kids, but there's kind of this saying that with drinking and nursing, that if you can find the baby, you're not too drunk to nurse, basically.
Hmm.
So there are all these misconceptions. You can drink alcohol and
Hmm.
nurse. You can take medication and nurse. Things pass through breast milk in such small amounts. And yes, there are things that you cannot take. For example, I could not take one of my there was one specific benzodiazepine I couldn't take because it would sedate the baby.
Okay.
But basically, we worked from birth to I had to go to formula after just a few days because we got put on this like four with my three maintenance meds and my four emergency meds. There were seven total meds. Out of seven psychiatric meds, there was only one that was not safe to breastfeed on, and it was because it would sedate the baby. So for 8 weeks, we worked on titrating me off that. At the 8 week mark, I was able to nurse, and I started to nurse, and she was doing great. I nursed for about 8 weeks, and then my husband and I realized that the nursing was actually impacting my mental health, and he said to me,
Hmm.
are you doing this for the baby or are you doing this for you? And I thought about it and I was like, I don't know. I
Yeah.
think I'm doing it for me because I didn't get to and I want to. And I just wish mothers would know that fed is best. Formula is great. My two daughters are incredibly healthy, incredibly athletic, incredibly smart, and they're both formula babies. And your mental health as a mother comes before anything because if
Yeah.
you are not in a healthy place, you're not going to be the kind of present mother. And we know so much about attachment now and how
Yeah.
important attachment is,
Yep. Yep.
So if you fail to attach because you're not taking care of yourself, you have to weigh like formula is safe. Your baby is going to be healthy. It's not perfect. Yes, nature made breast milk, and that's the ideal. But if your mental health is not where it should be, formula is the answer because taking care of your mental health makes you a more present mother, which is so important to develop
Mm-hmm.
that early attachment. Because we know, as a therapist, our childhood attachment style impacts the rest of our lives and how we attach to other people, how we communicate, how we have relationships. And
Yeah.
so I guess
Totally.
that's those are some things I'd really like new mothers to know.
Yeah, I mean, it sounds like a key takeaway for anyone going through the same thing. And I just have to say, like, your story is so inspiring and incredible. Like, the amount of strength that you had to have to go through all of that. And, like, even going through your program and college and all of those and dealing with shame and getting fired. I mean, I think I would lose my mind. So
Multiple times. So
right, right. But yeah, no, for real, like just the strength that it takes to just keep going with all of, I'm sure you yourself carried a lot of shame. Was there anything else that like really kept you to keep going and moving forward and creating this kind of beautiful thing that you now have?
uh, I guess, sometimes I have an intrusive thought when I'm depressed is, are you going to be okay? Are you going to be okay? And I don't know why my brain just says that a lot. And all I say is I have to be. I have kids,
Mhm.
you know.
Right.
I have a husband and I have children and it's my responsibility. So
Yeah.
um there's now that I have children, even though I'll have suicidal ideation, I'm not scared
Right.
that I will go through with
Right.
it because I know that that would ruin my children's life.
Yeah.
And my responsibility as a mother is to get these girls to adulthood with secure attachment, and
Mhm.
they need to be prepared that if they genetically they're very predisposed to have bipolar disorder or depression.
Mhm.
It runs in my family, and I even in my family I destigmatize bipolar disorder. I talk about how my when my daughter was a little bit younger, I would talk about how my brain is sick. This is why I would take medication in front of my kids. I'd say, "Oh, I gotta go take my medicine." My daughter's 8, almost 9 now, and she likes to play with my phone a lot. And she'll see since I'm in a manic episode or a hypomanic episode right now, I have timers to tell me when to take my medication. And
Mhm.
she'll pop out and she'll say, "Oh, mom, it's time for your Seroquel."
But you're really destigmatizing that, and
Yes,
like
because
that is part of you taking care of yourself.
when I was first diagnosed, I had no idea that that like I my doctor said you need to take medication, and I had this belief that people who take medication for their mental health are a weak, or it's a
Mhm.
very common belief, and you've probably seen this in your
Oh,
practice,
yeah.
that if you take medication to be yourself, then people only like you because of the medication. I don't know if you've heard that before, but
Yes, I have.
um,
Yeah.
yeah. So and then what also happens is that some people in situational depression, the death of someone, grief, losing a job, you can take antidepressants for a period of time and then you don't need them anymore because time heals the wound. There are people like me who will be on medication for the rest of my life.
Mhm.
And it takes a while to come to terms with that. And so, um, I think it's really important that I prepare my daughters for the fact that it's okay to take medication. Mom has bipolar. If you start to have symptoms, like look at me. I sometimes my daughter will be like, "But you sleep a lot. Why do you sleep a lot?" I'm like, it's because my brain is sick. But and I'll try to tie it back to, but look, I have a job. I have
Mhm.
a great life. I have these beautiful kids, and I guess I have a really big fear that my daughters will self harm or that they will be
Mm.
off at college and they'll experience what I experienced, and just the awful fear that I will lose one of them. And I guess something that I'm trying to battle with is how much to tell, how soon, because I want my daughters to know that nothing in the world could happen that is worth losing their life for, that
Mhm.
mom and dad will always be there. And so, like, for example, if my daughter is off at college, let's say she goes somewhere horribly stressful like Harvard and she's about to fail out of school, she knows that she can just come home and
Yeah.
we'll take care of her.
Right.
And that mental illness is not something to be ashamed of. I want to show her every day I am a capable person. I'm a nice, happy person. I'm a good mom. Yeah, sometimes I sleep a lot. And then I talk to her about it and I say, I'm a little sick right now and it makes me tired. Or I just, part of what I've decided to do in terms of raising my children is to destigmatize mental illness, to prepare them in
Mhm.
case it manifests so that they know this is not the end of the world. Oh, and I'm just going to interrupt with a story
Yeah.
that I loved. I listened to this podcast called Mental Illness Happy Hour,
Okay.
by Paul Gilmartin. I got to be a guest
Cool.
not last year, and tell my story about postpartum psychosis. But he had a guest one time with bipolar disorder, and he was undiagnosed until he was in his 30s, and he
Mm.
had some kind of episode where he woke up in a psychiatric facility And he was describing it, and finally they sit him down and they say, "You have bipolar disorder." And in his head, he said, "That's a death sentence."
Mhm.
He knew about were these celebrities who ended up committing suicide, but he didn't think he could have a happy, healthy life. He thought he
Yeah.
was doomed to die.
Yeah.
And then he went into a support group and he met this woman with bipolar disorder who was charming and calm and had a job and was just there to kind of get support. And he said, at that moment, I knew I could live the rest of my life. And I feel like that's what I want to do, A, for my daughters, but also B, anyone out there, especially young people who get a bipolar diagnosis, who feel like it's the end of the world. I want them to know, like, no, it's not a death sentence.
Mhm.
It's hard. It
Yeah.
is hard. I'm not lying. My life is challenging. I have a beautiful life. I have a ton of privilege. I have a beautiful, I have everything I need, but I live in sadness a lot. I live in
Mhm.
mania a lot. But there's meds that help me. I'm strong. I have good things. And I want young people who are getting this diagnosis to sit there and think this is not a death sentence. This is just something you need to manage. And one thing a lot of people with mental illness try to convey when they destigmatize it is would you be ashamed to take insulin if you had
Right.
diabetes?
Right.
No, it's your health.
Right.
And brain health should be given the same respect as body health. And it's not. We're not there yet.
Yeah.
So, for people like me who feel comfortable doing it, who have good feedback, who can articulate things like that, it's my responsibility to tell people, hey, your brain is sick, and that is just the same thing as your body being sick. And it is not fair that it's stigmatized and that other people think it's weak or you're
Right.
crazy. But you have the same basic thing going on as a person who has diabetes, who has cancer. And it's
Yep.
not fair that the world looks at your illness as being something um, negative, dangerous, crazy, whereas we celebrate survivors of cancer. We surround people who are sick physically with love
Mhm.
and support. When someone is mentally ill, we step back.
Oh,
We
they're
leave them
too much. Yeah.
alone.
And you're
It's
not
too much.
broken. You're not this terrible person. And absolutely, I totally, of course, I totally agree. And like, it's no, like, I personally, like, so I'm anemic and I have to take my iron. So, it's no different than that. Or like, taking my anxiety meds. It's no different than you taking your meds. Like, it's
Mhm.
part of being an adult. It's part of taking care of yourself, and it's a big responsibility, and you have to do it, and that's okay. We can destigmatize that.
Yeah, absolutely.
Yeah. So any other resources you would give people? I know you mentioned PSI and yeah, anything you want to mention?
Can I plug some of my own stuff?
Absolutely. Plug anything you want.
So my blog is www.mentallyillmotherhood.wordpress.com.
Mhm.
And it's most of it is about maternal mental health, but there's also some blog posts about different types of mental health. You can follow me on LinkedIn, Heather Gonzales, PhD,
Yep.
and I have a little lotus flower after it. I post a lot about mental health there. PSI, of course, postpartum.net, www.postpartum.net. That's probably the first resource you want if you're worrying about, if you feel like you might have something postpartum going on.
Mhm.
They have fact sheets. They have, it's basically like Psychology Today, where you can find practitioners, but they're specifically for
Oh,
perinatal mood and
that's
anxiety
nice.
disorders. There are peer support groups there. You can find a peer mentor. So there's there's task forces. If you get to the point where you want to work in advocacy, you can volunteer, and most states have their local branch. So I would start with going to the main page, which is www.postpartum.net, for information, and then find your local chapter. Those are going to be resources to help you find support groups, online support groups, in-person support groups, practitioners.
Mhm.
And then I was on a podcast called Mental Illness Happy Hour.
Yep.
If you want to learn more, a little bit more detail, I gave quite a bit of detail, but if you want to listen to like 45 minutes about my postpartum psychosis episode, that is www.mentalpod.com, and you just need to search for my name. And then I think, I'm going to forget do you know what the credential for perinatal mental health a therapist is? There's a
No.
specific
I didn't know there was a
certification.
oh, there's a certificate.
Yeah,
I didn't even know that.
there is. So just speaking to you, you have the for any therapist who has a blind spot, there is a specific certification. You can take tests. I'm sorry, you can take courses and,
Mhm.
and tests that will make you more of a perinatal mood and anxiety expert. If you feel like that's a blind spot in your practice, and I'm
Yeah,
so
cool.
sorry, I'm forgetting what the acronym is. But if you want that, if you're listening as a clinician, go to www.postpartum.net and you can sign up for the
Cool.
classes and then test, and then you'll know more about how
Yeah.
to help
Yeah.
someone in that space.
Totally. That is awesome. Yeah, and I've shared with you like I definitely think it's rare. I probably know one therapist in Minnesota who is like specialized in it, and that's, one.
Yeah,
So, yeah, I definitely think it needs to be more talked about, and there are opportunities to learn more about it. So, is there any other key takeaways or things that you want to
I don't
discuss
think so.
before
I
we head
think
out
we covered
today?
a lot.
Okay. Well, I just want to thank you again, Dr. Heather, for coming on today and talking about this because, like I said, like not only is this a blind spot for me, but I also think it's just something that is so real and vulnerable, but needs to be shared. Because the more we talk about it, the more we can relate, and the more we can destigmatize ourselves.
Yeah,
So yeah. Okay.
absolutely.
All right. Well, thank you, and we will be talking to you later.
Thank
Okay.
you so much.